Hi, everybody. This is Erica Mello and Susan Clinton, and welcome to episode number 171. And a little bit of a digression from our normal sort of patient scenarios. This episode is actually about managing patient expectations and managing your expectations regarding treatment and discharge. I often get asked, a lot of questions regarding, when is enough? When do you discharge patients? How long do you treat them for? What happens when you literally can't find anything and the person still has issues? And we've spoken about how a patient plateaus and what to do when that patient plateaus. That this episode is not about that. So if you are new to our podcast and you would like to learn what to do when a patient plateaus, just go into toughtotreat.com, type in patient plateau. You'll see a number of episodes come up on that. But this is really about, when do you actually decide enough is enough? Okay, so hope you enjoy the episode. Hi, everybody. This is Erica Mello, and I'm here with my wonderful co-host, Susan Clinton, and this is episode 171. Working our way to 200.
I was going to say, climbing our way up to 200.
Yes, we are. We didn't do something for our 100th. We'll have to do something for our 200th, right?
Yeah.
We'll do a big thing for our 200th. Yeah. So how are you?
I'm good.
Good. So in the intro, I'm sorry, Susan, go ahead.
No, it's all right. I said I'm ready to go.
Okay. So in the intro, I talked about patient expectations and how do you manage, discharge. And it seems simple at first. Patient gets better, they go. Not so simple, especially when you see the persistent type of pain patients that we see. There's always going to be, a glitch in the road. And once again, we've done numerous episodes on what to do when a patient plateaus. This is not that, okay? We all know what to do. You've either missed something, there's another driver, you need to go back. There's multiple episodes on that. Go to our website to find those. This is about, someone who, has some sort of degree of psychosocial issue. You're reviewing exercises with them and they've done them well in the past, but now they can't do them. Okay, and I'm thinking of a few patients with regards to this. And, I often get asked questions about how long do you treat patients for? What do you do when you can't find anything and you want to tell the patient, you don't want to tell the patient you can't find anything, right? I mean, you want to tell them something else. And so that's sort of what this episode is about. It can go many different ways. So I didn't really have a script prepared for this. Because there's so many ways you can approach this. So do you want me to start, Susan, or do you want to start?
Absolutely.
So I'll just use one patient scenario quickly. There's many other ones, but this was probably a couple of years ago. It was during the pandemic. So she came in to see me with a lot of low back issues. Her driver was her thorax and her foot, doing really well. I mean, really well. She was a runner. Obviously the foot's going to be involved with that, doing really well. She, was in a high stress job. I think she still is, working from home at the time, as many people were during that time. And, so I did not know this, even though we ask all these questions, Susan, about stress in the home. I treated her partner a little bit during that time as well. And he said, a lot of stress at home, which she did not reveal to me, which is fine, but there comes a point that needs to get addressed, right? And as a therapist, I went through my assessment again. I made sure her drivers were her thorax and her foot. I looked at different movement patterns, and, she wanted to go see somebody for acupuncture. I'm like, go for it. That didn't help. And so she kept going to other sort of, other practitioners like acupuncture, massage, and she was adding to the level of disappointment at one point. So she was doing significantly better. And I was literally about to say, you're doing great. You're ready, I think, to go out on your own or come in once a month if you want. Then something happened and I could not find anything wrong with her objectively. And let's assume that I had her drivers down well, that I got it. Like I was treating her appropriately for her situation. What do you do? And I get asked this a lot. What do you do when you're faced with that scenario? Do you want me to continue? You want to go?
Yeah, no, I think that there's so much that is going on in people's lives, and sometimes I think it requires that they either A, find a different type of support, or B, maybe they need a referral. And so one of the things that I'm going to put on my coach's hat here for a minute. When people come in and, in the very beginning, of course, we've talked about this before, and we'll do a podcast on it, is finding out what your patient's expectations are, maybe some management of patient expectations. When I'm wearing my coaching hat, they're the expert in what's going on in their life. They may have prescriptive stuff they need to work on, but they need to figure out how to implement it in their life. And so from a coaching point of view, really trying to find the deep, open-ended questions, but also maybe a little bit of motivational interviewing, which could take the form of looking at the idea that somebody could be really stuck in a values conflict. So they've got pain, they don't want to have the pain, they were managing it well, now they're not managing it well. And what's actually happening, what's the change talk in there? Is there some change talk, or is there issues that need to be kind of raised to the surface? So something that can help in those situations are, they'll say, I was doing really well, things were better, and then all of a sudden I started having more pain. And I can't figure out why, and I'm really upset about it. And so the way to reframe that is, you're having some increased pain, you're not really sure about why, and you've also done very, very well up to this point. So you kind of flipping it so that they can, so it's a basic reflection of summation.
Yeah.
And it's done non-judgmentally, but it puts them in the driver's seat to kind of start thinking about what else is going on. So, and you've been managing it very well.
Yeah.
So that's the piece, is that they're missing. It's like,
right,
managing this very well, what happened?
Yeah.
And oftentimes it becomes kind of the almost the victim type of thing.
Yeah.
This person can't help me, this person can't help me, this person can't help me. And it's maybe because they're trying to look at the problem in the wrong way.
Mm-hmm.
So there's a great podcast out there called Taming Your Advice Monster.
Oh, I like that.
Oh, it's hilarious. It's hilarious, but it has some really good points.
Yeah.
So the question he would ask at this point, and I've done this with some of my clients as well, what's the biggest challenge here?
Yeah.
Just sit back, let them be the expert. You don't have to figure this out. You don't have to fix them. And I know everybody's cringing in their seat right now, probably listening to this, but truly, this is something that needs to come from them. They're the expert in their life right now. They're just lost. So, and they've been managing it well. So remember that piece is crucial, because that's the piece that they need to have back, really, in a lot of ways, but they may have to manage it a different way now. Or there's another factor that they didn't, like what values conflict are they bumping up against, and their pain is like a reflection of that, perhaps, or they're having an inflamed spot, or they're not sleeping well, or, so they come up with what the challenge is. And then you go, and then what's the challenge with that? You keep asking about the challenges till you get it drilled down. So you may have to go into something like, okay, so they say, well, this happened and this happened, and, or I don't know what happened, but something happened. Yeah. And also, so what's the biggest challenge with that piece?
Yeah.
And, getting them to kind of figure out what really happened. You can ask questions about what else is what else is being challenged here besides your increased pain.
Mm-hmm. Yeah.
Tell me about, your other things that are happening in your life. How is your sleep?
Mm-hmm.
What are you eating? What's going on at work? What's happened? Is there anything particular going on in your life that wasn't going on before as you were managing things well?
Yes, that's the question. Because we always, look, let's face it, as a therapist, or everybody has an ego. Okay, you don't want your patient to come tell you, I come back to square one, or whatever. I'm using just that classic scenario, but we're all faced with patients in our life where, yes, you're going to get them to a certain point and they're going to, and their situation will change. So I do agree with you. It is interesting. So with a lot of those patients, I do reinforce the positive. I'm like, you've made such great progress. You're 90% better. And I do that. I will be truthful here. I do it to satisfy my own ego. And I also do it to reinforce them and say, look, you have made progress.
Mhm.
And I like the question about what is challenging you now that wasn't
Mhm.
challenging you then, because we, on this podcast, we talk about the sleep, the nutrition, and those should be standard in all of our listeners' questions.
Mhm.
They should be at this point if you've listened to us long enough, right?
Mhm.
But I do like what's challenging now. And so another question I will use, and so I'm going to get back to that, is what do you need now? And
Yeah, exactly.
what
And that's the
you
thing. What support do you need now? What is
right,
it that you need?
right. Exactly. And so do you need to go, the answer will be no here, but do you need to go and review the exercises at that point? Probably not, because that's not the overarching theme. As I said before, let's assume the exercise program was sound, the drivers are good. And when you get to a point when they're 90% and something's off, or 85, even 80%, and something's
Mhm.
off, it's not, it's something that is intrinsic. It's not an extrinsic thing. It's more of an intrinsic
Right.
to them,
Mhm.
right? And let's say this did happen with this patient, and I said, what do you need? What's going on? I didn't use the word challenge, but I do like that. I said, what's
Mhm.
going on in your life now that wasn't going on, besides the pandemic, right? And she was like, I've had a lot of stress at home with my family, and she was seeing a therapist. So what do you, so I'm going to ask this question of you, because I know what I would do, but they say have stress at home, they're seeing a therapist. As a physical therapist, as you see these tough to treat patients, we need to treat the whole person. And I know we've said this ad nauseum on the podcast, but this is a time when you need to treat the whole person, right?
Mhm.
Right. And so when someone says to you, I've got stress at home and et cetera, so what are you going to say? Okay, leave now and come back when that stress is better? No, I would not say that. What would you do?
So my thing is, when they say there's a lot of stress at home and they're seeing a therapist and there's a lot of things going on, my question to them is how is this challenging your health?
Yeah.
Tell me about what's happening around the stress. You don't have to they don't have to get into the exact things that's happening in the stress, but how is that affecting your physical body?
Yeah. Yeah.
If the stress levels have changed at home, how has that affected your physical body?
Yeah.
And then, and how has that affected your sleep? How has that affected your ability to problem solve? How does that affect what's being really affected by this?
Yeah. Yeah. Yeah.
You know,
Yeah.
because, and then it's good to also bring them to the point where they're talking about that. What support do you need? Well, I'm already seeing a therapist. Are they helping?
Right. Right. Yeah.
Do they know that this is going on, that this has increased?
Yeah. Yeah.
And it may be that, I'm seeing a therapist, but we haven't met for 4 weeks, because they
Right.
have a therapist that they go to, doesn't mean they're going.
Right.
It doesn't mean that they're liking what's happening.
Right.
And it's okay for them to say, just ask them, is this person, this therapist, are the things that you're doing with them helping?
Yeah. Yeah. Yeah.
It's kind. You're not trying to jump in. You're not trying to be a pop psychologist.
Yeah.
You're just basically allowing them with some deep questioning to figure out what their next step needs to be.
Yeah. I love that. And I think with people like this person or anybody else, like I did ask her this. I said, what has worked well for you in the past? And she would reel off all the exercises. And I was like, that's great, but we know those worked, like I know all that progression helped you, but what else has worked for you in the past? And she'll say, like she was traveling, like she has zero symptoms when she was traveling up. Of course, she's not near her family. Of course, she's going to feel zero symptoms when she's traveling. Usually it's the other way around, but and I said, what's worked for you in the past, and how do you usually in the intake, I asked them how they manage stress, and at the beginning I could tell she was a fairly good coper, and so I wasn't worried. And then all of a sudden this happened, and I was like, something has changed, and I cannot, and it's not an objective physical musculoskeletal issue that I can actually actively or passively get rid of. This is some self-efficacy. She needs to sort of understand that it's on her. And I think so, depending on your setting, like if you're in a high volume setting and you're pressured to see patients, you may answer this question differently. I'm on my own. So I said to her, I said, look, and plus I don't take insurance. So I said to her, I was like, do you want to take a break? Do you need time off? I put that right out there because look, at the end of the day, do I want to take her money when I'm not finding anything objectively wrong? I think that's unethical. Okay. However, there are many therapists out there who would continue, right? And for whatever their reasons are. But I do think sometimes people need a break. What do you think about that?
Well, it depends. So again, my thing would be brainstorming with her, what you need. I just don't know. Let's brainstorm some things.
Yes.
Let's just brainstorm, and let's be delusional about it.
Yeah. Yes.
Like, I want to go to a desert island and not have the phone ring and not be listening to news about the pandemic and blah, 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 blah. And make it just like ridiculous. And then they say something else. They make it like super ridiculous, like really like pie in the sky ridiculous. And that opens up creativity when you start doing that. That's a trick that writers do.
Yeah.
When they run into, I can't think of anything, that she knows what she needs. She just can't voice it. There's a big values conflict under there.
Yes.
And it's probably around her family. I'm just guessing, but it may not be. It may be that maybe something about something else, that her expectations are not being met somehow in her life somewhere.
Yep.
And so she likes these appointments because it gets her out and about, perhaps, or it gives her time for a little self-care for herself.
Yes.
So, but really brainstorming those things like you did, like, do you need time off?
Yeah.
What would you, if you didn't come here, where would you go?
Right. I like that one.
Where would you go? What would fill your cup?
Yeah, you need to,
if you didn't come here, if so it's not forever. Or do you need to just come here and work with me on wellness? This is your thing. Come in, we'll exercise together, we'll move together. And so for the people out there that are like, talking about ethics or not ethics or whatever, if you put it, if you place her in a different category, like, let's just stop the physical therapy goals for a bit. You've really kind of met those.
Yes.
But it seems like what we need is to really just come and work on breath and work on just quiet movement and things that'll feel nourishing and good for you. That's in the form of wellness. We can do that, or you can send them to your favorite person that, perhaps maybe so you're going to acupuncture, which is really good. That's a bit passive. Like the active movement, you have the exercises that you're doing. What if we put you into a different kind of movement that feels nourishing to you? Have you ever tried any of the following? Or what would you, have you ever, is there a class out there that you would love to take, but you just never had the time?
Yeah.
If this was not a part of your week, would you be able to do that? So that you're really kind of just problem solving some ways for them to keep moving, keep going, but acknowledging the fact that, that there's something going on.
Yeah, I love that. Yeah. And I think, we talk about physical therapists as health coach, health coaches, and we really are in the end. And I like, you talked about reframing the question earlier to the patient, but I also like reframing our role in her, what's the word? I don't want to use the word journey, reframing our role in her, you're using my hands here trying to think of a word, just in her whole presentation, for lack of a better word. So because we are coaches, and yes, we could take off the physical therapist role,
The prescriptive role.
exactly, the prescriptive role, and put on the health coaching role. Okay. And that's a whole nother podcast episode altogether, but I do like that. Let's come in to breathe. Let's do some wellness. I have access to Pilates. Let's jump on the Pilates equipment for an hour, however you want to do that. But you can't just, and I don't mean you as in her, but you in general, you just can't walk away and not replace what you were doing. I don't believe that. I don't believe that would get them better. They could just go sit in the park and read for an hour in the hour that they would be with me, if that's what they need. So when I said to her, I said, what do you need? What do you need now? And she's like, and so this is as I said, 2 years ago, and I'll tell you what happened in the end. So she took a break. And that's what I wanted her to do in the end. I didn't tell her to do that, but I said, you need to do something else in order just to sort of clear your head, because she was super vigilant, super hyper vigilant about symptoms.
Mm-hmm.
And I do think sometimes that changing the environment, even though you put on the role of a health coach, if you're in the same physical environment where it's a medicalized model, that may not be enough for patients. They need to physically remove themselves from that. And so a month later, she came back and I feel great, and it was about changing things up. And once again, I didn't, and she literally just did some long walks to the park, and, things at home got a bit better, things like that. And so it was a multifactorial issue, but I wanted to bring this up because it's like, when do you let them go? When is enough? Okay. And so I'm just going to bring up another person real quick. When do you tell the patient that you don't need to see them anymore because they're good, but they continue to want to come in? The complete opposite, right? It's the complete opposite, right? And this has happened to me as well. I mean, it's happened to everybody. What do you do in that situation? I mean, I'll think of somebody, this is actually recent, and I was like, you're doing really well. You pretty much hit your goals, it's the routine thing. I said, is there anything else that you want to do that you cannot do right now? That this issue is limiting you? He's like, no, I'm feeling good. And I was like, well, and he's like, but I still want to come in. And I was like, okay, ethically, get the ethics aside, but, I don't have a problem with people coming in for maintenance. I have zero problem with that. But when someone wants to come in every single week for 2 years and I just don't see I don't see the reality in that. What are your thoughts on that?
Well, so the question becomes, what is that coming in here once a week does for you? Would
Right.
be my question. Like, okay, so you want to reach, you're doing really well, and you want to continue physical therapy once a week, and you're doing really well, so I do that reflection with them. But then the next thing would be, again, what's the biggest challenge for you here?
Yeah, it's the same question.
If you didn't come in once a week, what would happen?
Yes.
If you came in once every 2 weeks, what would happen? I would just let's play a game.
Yes.
Let's just see, and probably more than likely, that sounds like to me that this is the place they go. It keeps them accountable. Is it a social piece for them? Like, they really like you and they like coming in and talking and doing their exercises. They look forward to it. What is the purpose? What is this serving for you? So that they can get in touch of why they really want to come in. If they can really talk about it, it might give you a reason to say that's fine.
Yeah.
I think that the question that people ask is that they just want to come in because they just want to come in, and it's like, there's a reason why they want to come in.
Yes.
Find out the reason, and then you need to is it something that they need? If they need accountability, perhaps maybe it's time to transition you over to my friend, the personal trainer, or to the Pilates person, or the yoga person, or the Tai Chi person, or whoever it needs to be. And so, and again, I love your question. Is there anything that you're not doing or wish you were doing, but feel like you can't do still?
Yeah.
Things have changed. You're obviously much better. So kind of where are we? Let's just check in. And what is once a week going to do for you? Tell me what that's going to do for you. In a
Yeah.
very non-judgmental way, not like, well, what's that going to do for you? But instead, it's like, you want to come in once a week and I want to know what that's going to, what support is that going to give you for what we, tell me about that.
Yeah.
Just tell
Yeah.
me about that. What's the challenge here for you?
Yeah. And I keep this reframing keeps coming into my brain. Reframe the question, even if and that's, you could do that on with your prescriptive hat or with your coaching hat, but
Mhm.
looking at a situation, whether it's a professional situation like this, or a personal situation in your life, whether it has to do with work or not, ask a different question. Ask a different question and you'll get a different answer. And I think
Mhm.
that, and that's worked for me both personally and professionally. I need to look at this from a different point of view, and I need to reframe it and change how I ask my question. And I think that's a good point for both situations, whether the
Mhm.
first one person I talked about and this person, because there's something he's getting out of coming to see me, obviously, and we need to sort of find out what that is versus,
Mhm.
someone, this is probably one of my coaches said to me recently. She said, you should, we're talking about commitment, and she said, you should, I haven't quite gotten to the last piece. She said, you should ask every patient that you see, whether it's a virtual patient or an in-person patient, what their level of commitment is on a scale of 1 to 10.
Confidence ruler. Mhm.
Exactly. And that's in whether we have a business coach or a personal coach, that's a commitment. And she said on a scale of 1 to 10. And she said, if they say a 5 or less, tell them not to come back.
Well, but the coach in me would say, why a 5?
Right. Yes.
Why a 5? Because
Yeah.
they may not be confident that anybody can help them,
Yeah.
especially if they've been at it for 10 years and nothing's
Yes.
changed.
Yes.
Why a 5? Could be that, well, I know myself. When things get busy, I tend to decommit, and it's like, okay, how would you be able to move that, knowing that about yourself? How would you be able to move that to a 6? What would it take?
Yes, exactly. Further questions.
Yeah, further questions. What would it take? What would you need? Is this the right thing for you
Hmm.
at this time?
Yeah.
Knowing what you're telling me about this. So instead of, I get what the person is saying, but there's ways to kind of get them to understand, is this really where they need to be right now?
Yeah.
So their expectation is, like for us with pelvic pain, I need somebody to do the internal work because it's the only way I'm going to get better.
Yeah.
And my question to them would be, the only way you're going to get better is to have internal work, and you're coming to a different practitioner.
Yeah.
Just kind of open it up for them. Tell me about the work that you've had done and how that has changed your pain. Tell me what's going on with that.
Yeah. Yeah.
Then they'll say something like, well, it really hasn't changed my pain, but if I don't do this, it'll get so much worse.
Yeah.
And have you ever gone any time without anything? Did your pain change and get worse, or did it stay the same?
Yeah.
Like, tell me a little bit more about that story. Where did that come from? And, it boils down to the fact that their expectation is that this is what they need. And so therefore they're going to keep chasing it. Whereas, so you don't want to you don't want to pull the rug out from underneath them, because they're clinging to that thought for whatever reason.
Yeah.
And most of the time it's because that's what they're seeing, that's what they're hearing, and that's what they're believing, because that's what somebody told them once upon a time.
Yeah.
And so the question could be, what if you could get your pain to change by doing something different?
Mm-hmm. Yeah. I like that.
Well, that would be what that is. What do you think you need? You've had the other stuff. What else do you need? If they keep saying, I don't know, then you can brainstorm with them and say, let's talk about a bunch of things that, maybe haven't been considered, that you could think about. And, the whole goal then is to get them to see if they can change their confidence ruler up.
Yeah.
They can't.
Yeah.
And at some point you may say, I'm I'm not the practitioner, I'm not the best fit for you.
Right. And it's interesting
It's
because
really not for you. And I totally understand why you wanted to come here and do this, but it's not how I work. It's not going to meet your expectations. It's not going to serve you in the way in which you wish to be served.
yeah,
And they may get a little bit like, what is it that you do? And it's like, we talked about it. This is the approach that I take, and this is how I work with people.
yeah.
But if this is what you want, let's get you to somebody who will do that.
Yeah. And these conversations and these skills are crucial to have early on, because you're gonna get up in a situation where, the patient either is not improving, or you're getting frustrated or burned out because they're not going the way you want them to go. And so I think, we all need our clinical skills, obviously, but this is part of our clinical skills. This interviewing and this problem solving is part of the whole physical therapy curriculum. It should be anyway, if it's not.
Yeah. And I think the other part of this, for people who are out there listening and saying, I don't have the choice, the clients come to me because they're referred to me, and that's that. But you do have a choice in how you work with them.
Yes.
You can start off in the beginning if they're very pre-contemplative, like they don't even know that they need to change. Why am I here? Because the doctor told me to come and see you. I didn't even know there was physical therapy for this.
Yeah.
Okay, that's a very pre-contemplative patient. So you look for the change talk. Tell me about why you went to see the doctor. Rather than why are you coming to see me, and they don't want to be there, but why did you go to the doctor? Tell me about the story that led you up to going to this particular physician.
Yeah.
Oh, I was referred to that physician. By who? What got you to the person that referred you to? Get in and find their story.
Yeah.
And it's like, well, they just said I need to exercise more, and I can't because my knee hurts. And because my knee hurts, I don't want to exercise. I'm just taking it away from the pelvic world for a minute. And therefore, they made me come and see you.
Mm-hmm.
Like, tell me a little bit more about your knee pain. I wouldn't even go that direction with them. I still want to know about their knee pain. What is your knee pain preventing you from doing?
Yeah.
How long has it been going on?
Mm-hmm.
What would your life look like if that knee pain got 50% better? Like looking for the change talk. So you can do that rather than sitting there and listening to it and getting into their negative talk with them. Remember, saboteur contagion. They come in with their saboteurs raging. They're going to trigger yours. So you have to stay into your sage brain. You got to be mindful in the moment and, just kind of find out what's going on with them. No one's ever asked them.
No.
And they don't expect you to either. They expect to fight with you.
Yes.
And those are the kind of clients that you can just say, wow, this is such a story on a scale of 1 to 10. Do you really think this can change?
Yeah.
Or how much can this change for you?
Yeah.
They may say, not just a 2, it'll never change. And it's like, really, a 2? Have you ever had any time that you can remember where it wasn't so bad?
Yeah.
Like even recently, do you have some days where it feels a little better than other days?
Yeah.
Well, yeah, when I rested, great. So rest helps.
Uh-huh.
What makes it worse? So then you kind of all of a sudden you've got pulled them into the game and you're really listening to what they say.
Yeah, it's so interesting because you almost want to manage expectations. Like referral sources, depending on your clinical setting, a lot of people know what they're getting when they come to see me. They know and there are a few who don't, because they're referred from somebody I know, or a doctor who doesn't know me that well, but I know, but they know I get patients better. So I had someone a while ago, and I'll just end with this example, who, traditional, like, I have knee pain, and I'm like, well, it could be your foot. This was I hadn't even seen him yet. Oh no, it's definitely not my foot. I've had it treated. I'm like, well, have you? And so this isn't even before I saw him. And so these people have these preconceived notions that, yes, they have knee pain. I understand that it may not be my knee, but it could be, it's definitely not my foot. And, I meet the person, I do the eval. I'm like, it's partly the foot, partly the hip. And we're going along, and he was very much of the traditional physical therapy model, had always had that. It was something that, and so for me, I don't treat that way. And so that expectation was not managed from the get-go, right? He came in because he didn't really know. And so I explained to him as best as I normally would do in that situation, and he got it. But then when we were coming to exercise, right? And I do a lot of imaging and cueing, and I would gave him something like in a down dog position and it wasn't stretching the calf. It was like doing some, full dorsiflexion, knee extension, knee flexion, just to mobilize the back of the knee and just get some excursion in the tissues in the posterior part, in the popliteal fossa. And he's like, I don't feel a stretch. And I'm like, you're not supposed to feel a stretch. And I could not get him off from this stretch thing.
Mm-hmm.
He says to me, he goes, Erica, I'll never forget this. He goes, Erica, I'm a linear thinker. And a light bulb went off in my head. And I was like, this guy's a linear thinker. He's never gonna get it, with this approach.
Mm-hmm.
And I had to change gears very quickly. And I said to myself, maybe he's not the person for me. I actually thought that,
Mm-hmm.
and because I can get a little bit frustrated sometimes with that. And I will admit that. And I know to control that. But I was explaining to him about, how I normally do the tissues in the back of the knee, the nerves. And he was like, but I don't feel a stretch. He was harping on the stretch. And I was like, I'm not doing this to stretch your calf. So do you have any thoughts on that? Or
yeah,
that's frustrating. I'll tell you that.
One of the questions that would be is like, okay, you're a linear thinker.
Mm-hmm.
Tell me what that means.
Yeah.
Tell me what that means. Tell me what's going through your head right now about this process and how that doesn't jive with you being a linear thinker, so I can understand. Tell me more about that.
Yeah.
And let them launch into it, and whatever it is, and say, if they want, and so what's going to support your journey to heal? Yeah. I want to do things like this and this and this. Great. Let me get you to a practitioner that can do that with you.
Yeah. And it's interesting. That's what I did.
And that's okay. And then they come back out and say, well, that's not what I blah, blah, blah. And it's like, but this is what you want. This is where you want to go. You have every right. They have every right to choose the pathway that they want to go down.
Yeah, I agree. 100%.
And if that's what they want, then they need to, but you got to get them to be able to say it. And so, he was harping on the stretch and you were like, this isn't meant for that. And he's like, I'm a linear thinker right there. That's what I would say is, tell me about that.
Yeah.
Just hang in there with it and see what it brings up.
Yeah. And
it may even resolve itself. Like he may say, the next thing may be because you listened and you asked about it. He may say, well, what I need to do is I need to get out of tunnel vision.
For sure.
Okay, so how in our process that we're working, how will that support that?
Yeah.
How do you want to think about things differently? What's tunnel vision? Tell me what tunnel vision is.
Yeah.
So you can kind of like, you can work through that a little bit better. But the goal here is to, when people have expectations, don't, for the listeners out there, do not beat your head against the wall with it. Their confirmational bias is strong. And when you challenge people's confirmational biases, they're going to dig deeper into it before they start to let it go.
Mm-hmm.
Witness the issues we have going on in this country right now.
Yeah, for sure.
But the point is don't challenge their confirmational bias. Ask about it.
Mm-hmm.
Let them tell you what it is and what it means about their body and their health. You're not asking them about their childhood and their trauma. You're asking, that if they have that, then you definitely need to help them find somebody, especially if they're not seeing anyone while they're working on their physical body. But the point is that, you're a healthcare professional. And so you've got to ask about what, this is what I do, or
Yes.
this is what I think, or this is what they told me has to happen. Their expectation may be coming from their referral source.
And that's what, in this case, that's what
they said, you do such and such. And it's like, tell me about that.
Yeah.
Because I know this referral source. Tell me what they said to you.
Yeah.
Well, they said this and this. And it's like, did they say anything else? Did they mention anything else? They kind of talked about this and that. And they kind of, then the story comes out, they latched on to one thing that the referral source said. And that's what that's what they brought with them. And it may
Right.
not be what the referral source says at all.
I know. And then that's setting
said or something.
and that sets them up for disappointment, and you as a therapist up for frustration. And it's interesting with this particular patient. I was like, what did Dr. Blah, blah, blah say to you? And he's like, oh, he said, you're a detective, you'll figure it out. I'm like, that's it? That's all he said? He's like, yeah. And I was like, okay. And so, with the whole linear thinking, I was like, and I kept, a few sessions in, and I was like, it was the same problem. And so I did exactly, I said, I'm not the one for you. And I always said it very nicely, but let's be honest. There are patients who bring out the best in us, and we do really well. And these are people we love to treat. And then there are people who don't bring out the best in us, but we treat them and we work around it. But I think you have to make a judgment call. And yes, once again, if you're in a clinical practice working for somebody, this may not be an option for you, or you can just move them to somebody else's schedule, right? And I think that marks that's a clinical expert, knowing when to let go, right? That's the hallmark. What makes a clinical expert? That's what makes a clinical expert, right? Knowing when to say, I can't help, I'm not the one for you. So
remember, the people that light you up are people that are coming in their sage brain. There's sage contagion, mirror neurons. There's a real mirror neurons, right?
Oh, I love it. Yeah.
With expectations that match yours, they're all lit up and ready to go, and your brain is like flying over into its sage part of its system, and serotonin's
Totally
good to go, and problem solving's happening. The ones who don't show up that way, those are your trainers.
Yeah.
They're there to help you grow.
Yeah, exactly. And
They're
that's how
Yeah.
help you grow. And that's how we'll end this episode. This was a good one. I know people have a lot of questions about this, and I thought this was a worthwhile conversation, and it was great. So we'll on that note, we'll grow, and there you go. Well, enjoy the episode, or no, hope you enjoyed the episode.
Yes, and give us your feedback for sure.
Yes, any questions, you know where to reach us. Enjoy.
And don't forget to leave us a review.
Yes.
Help us.
Please.
Help other people find us.
Yes.
Thank you so much.
Podcast.
Mm-hmm.
Bye.